my pleasure to introduce Dr. David Gute today. One of the wonderful things about teaching at Tufts is to be surrounded by amazing, amazing colleagues, and Dr. Gute is one of the people that I have sort of so enjoyed throughout my career at Tufts. He's like a who's who in this field of sort of public health epidemiology. He's worked for the state of Rhode Island, he'd worked for the state of Massachusetts, so if you're thinking about working in the government sector, he knows all about it. Then he came to Tufts, and he is in the School of Engineering, and he has appointments in the medical school, and there are others, I think, as well, but I won't belabor the fact he's an active epidemiologist. He works all over the globe internationally. He's worked in Ghana. He just came back from 4 weeks, more or less, in India. He works here in Somerville, which is what he's going to talk about today. It's just inspiring to see sort of the way he takes his public health perspective with the engineering sort of solutions-oriented perspective and thinks about how we can address pressing issues facing society, and recently begun to really think about environmental justice. Who is it that's sort of suffering from the kinds of challenges we face today in cities like Boston? So, David, welcome. Thank you for coming.
Oh, thank you. Thank you very much. It's my great pleasure to be here. Yes, I've just returned from 27 days in India. I recommend that as a travel destination to any of you. I was able to combine professional stuff along with tourist stuff like riding a camel, sleeping in a tent on a desert. Fact that I did not know is India in the western part actually has a desert. And so it was a remarkable trip in many ways. So yes, what I'm here to do today is to talk about environmental justice, probably in a slightly different context than you may have thought about previously. And it represents one of the few funding opportunities that were capitalized on as a result of good planning. We were presented a number of years ago with an offering from the National Institutes of Health that was very interested in environmental justice. And we noticed that the National Institute of Occupational Safety and Health, or NIOSH, was going to be also a co-funder of this. And we decided that as a result, we should pursue environmental justice, but through an occupational focus. And one of the things I'd like to say at the outset is I teach a course on occupational and environmental health. So the way I think about this is I think of environment as the parent and occupational exposures as a child, and this sort of hierarchy. So I am not perplexed at all by trying to sell you on this notion that you can actually advance environmental justice through looking at it through an occupational lens. The final thing I'll say in preparatory to the slides is, yes, I am an epidemiologist embedded in the Civil and Environmental Engineering Department at Tufts, and I lead an environmental health group that is made up of true public health engineers, Danielle Fontaine, Amy Pickering, Helen Sue in air pollution, Mark Wooden, and Anne-Marie Damaris. Some of those faculty members you may have interacted with. And the thing that we try to do is to ensure that the engineering skill set is looked at as ways to develop interventions within the broad area of public health and environmental health. And so that's what you'll hear a bit about today. So the lengthy title has already been explained, I think, by my opening comments. And please, if there are any questions, please interrupt me as I go along. So the work actually unfolded in Somerville. Somerville is an extremely interesting community, which I'm sure you're well aware of. One of the things I always hear from administrators at Tufts is, why don't people work more in Medford? You know, as in contrast to Somerville. And Somerville is just so darn interesting. I have done some work in Medford, but mainly my work has been in Somerville. So the partners were structured around various community-based organizations. One of the things that is a pressing issue in public health is who represents the community? It's a very interesting question. You know, is it the mayor? Is it the beauty salon owner? Is it the social activist? Who actually represents the community? And one of the things that unfolded in this project was working with community-based organizations. And one of the things you need to be careful about as you work with community-based organizations is to ensure what you're engaging with them in a sort of common effort doesn't distract them from their principal missions. I mean, part of the ability, particularly for academics to work with community-based organization, is to add to their capability, not distract them from their core missions. So one of the things that's also of interest here is the degree of alignment between the community-based organizations that we worked with and the topics that we were addressing. We also worked with the Cambridge Health Alliance and marshaled various university resources. We're trying to look at environmental justice through the trajectory of work. So let's think about work for a second. And let's think about recently arrived immigrants. What kinds of jobs are they going to have? Tend to be riskier, tend to be less secure, tend to be transitory in certain ways. How about language facility of recently arrived immigrants? May not be up to par in terms of voicing concerns that they encounter in the workplace, knowing the rights of a worker in the state of Massachusetts, being able to follow instructions in terms of if they are provided training on how to keep themselves safe on the job. There's a variety of sort of cascading elements that can imperil recently arrived immigrants, and this was part of the motivation for our work in Somerville. And how did we pursue it? Through both quantitative and qualitative methods that we'll explain in greater detail as we move through the slides. So our setting, I've already talked about some of the attributes of Somerville. One of the things also that is a great little takeaway is what did I learn about convening community-based meetings with community-based organizations? One, you've already satisfied the criteria. Serve food, extremely important. Second, provide childcare. Always a big draw for people to come to meetings. Third is talk about topics that are of interest, to the community-based organizations. And I think one of the things that rearranged my own thinking in many ways is in public health, we usually seek out problems. We seek disparities. We take counsel from the fact that one group might have a greater rate of disease than another, and we attempt to intervene. One of the things I was taught by my interactions with the community-based organizations is let's not forget about the assets of the community, as opposed to just focusing on the problems. What are the assets? And so one of the things that I certainly gained from these interactions is coming away with a greater sense of what some of those assets might be. And here you see some of the points that I think are of importance to us. One of the central ones also is Somerville being a host community, right? So definitely there's a strong impetus to do work in such a community. So here's the specific lineup of the partners. Here we had Tufts University, we had the Cambridge Health Alliance, the provider of healthcare in Somerville and Cambridge. We had the Immigrant Service Providers Group, the Community Action Agency of Somerville, or CAAS, the Haitian Coalition, and the Brazilian Women's Group. Each of these four groups had a visionary leader and one who was extremely committed to advancing social and environmental justice in their daily work. And some days I would be sitting in my office and I'd be talking to one of my colleagues in one of these community-based organizations, and I'd be dealing with the usual press of academic work, going to some committee or finalizing a paper for publication. And these folks would be out fighting to make sure that one of their clients is not deported, or trying to intervene in a housing situation which was intolerable for one of the members of the organization as a result of discrimination. Real life, acute issues of importance peppered the calendars of all the people that are and the organizations that they represented. It gave me a sense of, gee, what can I do as an academic to essentially assist folks who are dealing with these kinds of pressing issues? The other thing that we did was we recognized we needed additional technical assistance, so we enrolled the Massachusetts Coalition for Occupational Safety and Health. These CAAS groups are spread around the country, and the Massachusetts one has had a long and proud tradition and providing technical assistance both to workers as well as managers of companies trying to ameliorate occupational safety and health problems. Now, there is a well-known disparity among immigrant workers. Immigrant workers tend to suffer greater consequences that are work-related from some of the reasons that I've already mentioned. Unfamiliarity with regulations, lack of adequate training, impermanence of the job cycle. One of the areas of employment that we spent some time on was the so-called day laborer. The day laborer is somebody who shows up at a Dunkin' Donuts and waits for a car to drive by and essentially be offered, say, a day's work, and the person who then fulfills that request is getting in a car, not knowing what they're going to be doing, not knowing if they're going to get paid at the end of the day. All of this it can sort of telescope into a situation which is perhaps even more pronounced in terms of some of the adverse consequences than more regular employment. So Bindu Panikar was then a doctoral student, now an assistant professor at the University of Vermont in the Rubenstein School of Environment, and she was the principal driver of the work that we did. And Bindu became extremely interested in women day laborers. So one of the papers that emerged from her work was in-depth ethnographic interviews with women working as day laborers and the sort of tales that they told and the risks that they felt and the ways that they attempted to protect themselves formed one of the stronger narratives that emerged from this work. But anyways, there's a disproportionate risk among immigrant workers. And the AFL-CIO and other kinds of outside observers have articulated some of the barriers, to progress. Language, lack of training, exploitation, certainly, which we saw examples of, throughout our work. So these are well known. Oh, it must. I'll just populate this whole thing. There we go. Okay, so what did we do? We conducted surveys. So quantitative data and qualitative data, conducted focus groups to better understand some of the work that we might do. We actively sought out key leaders in the community and interviewed them in depth. We also looked for publicly available data. One of the things that you should always ask yourself is, are you recreating the wheel? Right? Has somebody already looked at the problem that you are interested in? And one of the things I think that's clear in the area of immigrant occupational health is that many people do not, who fall in those self-identified categories, immigrant workers, don't want to participate in surveillance activities. And this is increasingly true now, as it was in contrast to the work that I'm reporting on here essentially ended about 5 years ago, but the climate has only worsened in terms of the degree to which immigrant populations will give up information, interact with people they don't know or trust, and provide personal information. And so one of the things is that there wasn't a lot of available data in Massachusetts or in other states as well. We also engaged in a number of activities, and one of the things that's true about the range of activities is they were quite varied. So you're going to hear about the creation of a group of teen educators. These are young people in the community, bilingual members of the community who could go out and interact with workers and obtain information, immigrant workers. We also supported the Verde Women's Co-op. This was a cooperative mainly populated by Brazilian women cleaning homes. And the idea of the co-op was to provide solidarity to one another, but also to allow them to be trained in occupational safety and health, additional computer skills, English training, as well as some other supports, and I'll tell you about that. And we also implemented some workshops and health fairs, generally being supported by all the community-based organizations, plus the Cambridge Health Alliance, the hospital. So one of the things that I told you at the outset was it's nice to be able to align the research and the outreach activities of grant-related activities to the core missions of the community-based organizations that you work with. And this was we were able to accomplish that because some of the community partners had already used some of the youth that they work with to educate the community about various health and environmental issues. So one had been engaged in the primary prevention of tobacco cessation. Another group was very interested in brownfields before we started to work with them. And so we thought that we could reconceptualize environmental justice being seen through an occupational lens without diverting these groups from their ability to do the things that they were already doing. In fact, we could add additional skills. And so this is really also about capacity enhancement of the community-based organizations. So the teen educators were young individuals here. There I am shaking hands with some of them. And the thing that they were extremely adept at was breaking down the chasm that can exist between an academically motivated research activity and the community. Because the teen educators were individuals from that community. And one of the things I remember when we proposed it in the grant review cycle, we actually got a comment back from one of the reviewers saying, teens have been used to educate younger students, say, about smoking or increasing exercise or maybe protected sex or whatever. But it's never really been used to have the teen, the 16 or 17-year-old, then interview and interact with adult workers. And that was the model that we were proposing. And so essentially the comment was, gee, this looks a little risky, but it also sounds enticing. And in fact, it worked very well. There was an ability for the workers to feel relatively at ease in talking to the teen educators. We did learn some lessons, however. We originally had conceptualized of having the teen educators essentially, walk along city streets in Somerville and conduct interviews sort of on almost a convenience sample basis. And it didn't go well. The women felt vulnerable in terms of having conversations with people, and then the male members of the team felt that they had to be overly protective of the women, and so what we eventually decided to do was to only have the teen educators work in settings where there was an envelope of an activity that had been convened either by the community-based organization or by us collaboratively, something like a health fair or a meeting or other thing. And then what would happen is we would have the large group of people, and then there would be interviews going on in secluded areas off the main meeting room as a result of the teen educators walking around and having conversations with people. And this produced 405 survey results, and we also encourage the teen educators to act as, I say, fulcrum for change here. What they did was they would go and testify at alderman meetings or city agencies. They would talk about some of the work that they were doing, and they became individuals who were quite empowered about their work and their belief in their community. And some of these folks had transitioned from talking about tobacco or brownfields and almost naturally sort of learned and became familiar with some of the things that we were trying to advance with regards to occupational health. So there was this sort of transition, favorable transition. The other transition that occurred was among the community-based organizations. So when we first initially started working with them, we would have meetings in which we said, oh, we're going to conduct surveys. And the community-based organizations sort of clapped their hands and said, oh, we do that all the time. That's great. We love to talk to our members. And they said, we'll just send the surveys out. We do it all the time. No, there's such a thing as the IRB, the Institutional Review Board. And they said, oh, interesting. And we used the process steps that allow academics to produce this sort of chain of custody of evidence. The fact is you cannot ask certain kinds of questions without protecting the confidentiality of people. And what's the most consequential question you think that could arise in interactions with immigrants? What would you pick as being the topic that is probably the hot button issue? Are you documented? Exactly. So what did our community-based organizations tell us? They say, never ask that question. And essentially, that's what we did. We never asked that question. It could arise in conversations, but we never directly asked that question because everyone essentially said you're going to chill the effect of people participating. And I think, again, this work ended about 5 years ago. It's even a more toxic atmosphere now, right, in terms of raising those kinds of questions. But the teen educators really worked quite effectively. And how did we engage in training? Well, some of it was this occupational health sort of immersion in sort of basic concepts of occupational health. You can't really make out some of this, but it's the upper right is a hazard map of Burger King. Basically, stay away from the hot fry lighter, make sure that the floors aren't wet. And the hazard map was conducted or actually implemented, drawn up by teen educators who were working at Burger King, right? And so the idea is you try to take knowledge that they already possess and see it in a slightly different lens. So then the question becomes, how do you prevent accidents from occurring? How do you prevent that? One interesting takeaway there was, I remember having a detailed conversation in a focus group with a Haitian woman working in a restaurant, and essentially the narrative that she told is that she was at fault as a result of slipping on a wet floor. And no matter how many times we would go back over the fact that the wet floor shouldn't have existed, there should have been preventive steps that had been taken. She just could not give up the fact that it was her fault entirely as a result of that fall. And it came to light that after further reflection, there could be cultural norms of assigning responsibility for things that are going to differ by context, by the way the person thinks about themselves. And I think that is also sort of another takeaway from this work, is that the variety of populations that we worked with, Portuguese-speaking Brazilians, Spanish-speaking El Salvadorans, and Creole-speaking Haitians is the individuality of some of the sort of the nuanced relationships of some of these risks. You cannot overemphasize the need to really, as well as possible, understand the population and the language requirements and the socially derived norms that are accepted in various cultures. Very humbling work, because you think you have it figured out, and next day something else happens and just reminds you of some of the distance that can actually exist between you as an outsider like myself working with communities. So this kind of training would go on in various aspects. There were issue development meetings in which a lot of interaction between this is Ismael Vasquez, then working for CAAS and leading his team of teen educators. The other group that was Franklin Delamblere in the Haitian Coalition. That was the group of teen educators. There would be cross-training between the groups. There would be meetings held on a weekly basis to develop various aspects. One of the things that emerged in the work from the IRB was that the IRB would sort of raise a question with a particular survey element and say, oh, you need to revise this. It turned out that after we had gone through a few iterations, the students became acutely aware of what the IRB wanted and would be usually the ones who were in the forefront of saying, no, 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 you can't ask the question that way. Or, no, 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 we need to come up with some other better ways of getting consent. And so it was this progression of the community-based organizations initially thinking, well, why do you even need an IRB, to the teen educators becoming very skilled and knowledgeable about the process, so that they were actually doing their own submissions at the end of our process. So it was really kind of interesting in that way. We had health fairs in which Alex Peary was another one of our, another one of our champions, the Immigrant Service Providers Group / Health. And so one of the things I've said repeatedly is that in thinking through who you might enlist to have a activity arranged around immigrant workers, you couldn't have come up with a better organization, than Alex's. And he was an intellectual and emotional champion of this work. And he, along with these other leaders of community-based organizations, just really offered us a context to work within. One of the things he was extremely interested in is making sure flu vaccines were distributed for free. And so this was the entree, if you will, to an annual event that we did for at least 3 years. The grant ran for 5 years. Maybe we did it 4 years, but it was always a big event to piggyback some of our occupational work on top of the flu vaccine as the draw for people to come. The final thing I would say here also is, who comes to a health fair? Is it the most marginalized section of your community? Probably not, right? So one of the things we recognized from an epidemiologic standpoint, and the people who would come to these events, we were confronting selection bias. These are people who were card-carrying members of the community-based organization. They probably had greater language facility. They felt comfortable coming to meetings. And what about the people who are not coming to the meetings? So eventually we decided, well, we have to do targeted outreach. And one of the groups that we really wanted to get were the day laborers. And so our last health fair, we actually went out, we just sent people out into the field. We knew where the day laborers congregated, and recruited them essentially to come to the health fair. And this was a health fair that was run by Cambridge Health Alliance. So the Cambridge Health Alliance was arrayed around U-shaped tables, just like this, and they're noting down cholesterol levels and blood pressure and referring people to primary care physicians and all that kind of stuff. And they were just amazed, essentially by saying, these are the people that are so hard to get. we just don't see these. How'd you do it? You know, and it's not like we got 100 of them or anything. It was probably on the order on that day in that health fair, probably 50 of these folks came from the sort of day worker group, and it was a remarkable thing for these, you know, sort of hardened professionals who are used to interacting with the community on a regular basis. They were seeing people that they just never, the types of people that are just so hard to reach. And having hard to reach populations was, I think, another success of what we were able to achieve. So those health fairs, here's a bit more about Verde. The other thing that also became clear to me is sort of looking at the assets that each of the community-based organizations represented. The thing that the Brazilian Women's Group, which is the parent, and Verde is the child, is extremely good at was marketing, creating videos, performing, they would perform plays about some of the things they were trying to educate people about. Just this remarkable fluency in interaction through a number of different media. So video, plays, narrative, and just you know, sort of community meetings. So the Verde really had a good understanding. This means green life. And the other thing that they decided that they wanted to do, which from a civil and environmental engineering standpoint was an excellent idea, they're a house cleaning cooperative, and they decided we're going to have environmentally friendly cleaning products, right? So, in civil engineering terms, that's source reduction, right? You're reducing the amount of toxics that people are handling, and so you're accomplishing a number of goals. You're lessening the exposure to abrasive, caustic agents on the part of the workers, but guess what? The client also benefits, right? And so that became a marketing advantage for the Verde house cleaners to go out and say to clients, yes, your home will be cleaned, but it also will be cleaned in a way that isn't going to introduce extra toxins into your home environment. And being science engineering based, one of the other things that cropped up in our minds, and this occurred to the Verde colleagues as well, is how could we actually document the fact that these natural cleaning products work as well as Ajax or, you know, Comet or whatever else you're using? So there is such an organization that does these kinds of tests. It's called the Toxic Use Reduction Institute up at the University of Lowell, Massachusetts. And so what they did was devise a set of tests to essentially talk about the speed and the efficacy and the overall ability of these natural cleaning agents to work as well as some of the more commercial caustic ones. And so that those data were actually assembled as well. And so Verde is the organization which you know, supports the co-op. The progress that we made was noted in some unexpected ways. One day, I'm sitting at my desk reading my email, and it turns out we were invited by the National Research Center for the Working Environment in Copenhagen. Scandinavia is the Valhalla of occupational health. There's a great emphasis in all the Scandinavian countries to place emphasis on worker safety. And the Copenhagen group heard about the work we were doing and invited Eloisa Galvao, the president of the Brazilian Women's Group, and myself to go over and spend 3 days with them, sharing the lessons that we had learned. And one of the things they told us was in Denmark, it was very hard to acculturate immigrants because the standard line was, well, you have to learn Danish. You know, that's the way you're going to gain entry into Danish society. Danish is a challenging language, and they were looking for other things that might not fall within the province of government, because that was the other thing that people, at least the professionals that we were dealing with, the ones who were working at this National Research Center, said there's an expectation in Denmark, because you pay a high rate in taxes, that the government is going to figure out a solution to just about any of your problems, particularly on the social side, right? If you're having trouble acculturating, well, we'll get a government agency working on that. And so Eloisa and I listened to that, and then they said, gee, in the United States, you seem to be doing this outreach, but a lot of it is done outside of government. You know, you have community-based organizations forming. What's the secret to your success? You know, they wanted to know this, you know. And so it was sort of an interesting, and then the other thing they said is, and we have no way of reaching our immigrant populations. And Eloisa at that point said, that's ridiculous. You know, she said, there are networks to reach these people, and you're just not tuning into it. Because one of the things I recognized in dealing with some of the immigrant populations in our area in Somerville is information would just flow like wildfire through the networks, usually cell phones or other forms of communication, or soccer clubs, or social organizations, or you know, and the information just went through very quickly, you know, very coordinated. And what the Danes were saying is, our immigrants aren't organized, and we have hard trouble reaching them. And so one of the takeaways, I think, for them was it is possible to gain access to some of these networks once you build trust, once you understand, you know, how some of these things are organized. The thing that was very encouraging is, I remember there were 5 people who met with us. 2 were epidemiologists, 1 an engineer, and then there were 2 anthropologists. And that's another key to the success, I think, and some of the learning that we've done within the environmental health group is, if you're working with communities, find some good anthropologists who can help you understand some of the cultural differences that might exist. And so we had a very successful visit there in Denmark. So what are the lessons learned? Involvement with communities and the organizations found in them. And let's make sure that we don't equate the organization as totally representing the community. You know, you're going to have different ways of that coming about. Found in them inexorably leads to a recognition of the interconnectedness of issues. And so that was something that occupational health, environmental justice, and then the broader theme of social justice, very interconnected. The scales of the community and the academics, time scales of the community and academics can be quite different. You produce a research result that it can be leveraged by a community-based organization. Do they want to work until it's published in a peer-reviewed journal? No, they want to go to the mayor, they want to go to the governor, they want to go to the local paper. They want that data out there and used. However, if you're an academic, different time scale. And so one of the uneasy sort of equilibriums that was established, there was a grudging recognition, initially at least, on the part of the community-based organizations that there's certain vetting processes that have to happen with these data. And they started to recognize that once something was peer-reviewed and then published, they could use it even more effectively than, say, data that hadn't gone through that process, right? It's not perfect. There's still unease with that. And in fact, if you ask me, what's the area where we need to do even further thinking about it, is this: how do you marry both sets of interests best when you're working with a community-based organization? Working definitions of environmental justice may not be all that dissimilar. One of the things I always urge people to do, I urge people to do 2 things if you're doing multidisciplinary work. First, have a discipline that you know. Sociology, economics, mathematics, engineering, whatever. Know that as well as you can. And then you have skills to contribute. The other thing is work through a set of definitions that sort of go across the various lines of your multidisciplinary team. So I have a very good friend in civil and environmental engineering, Masood Sanieh. He's a structural engineer. He builds bridges. He talks about risk assessment. I'm sure many of you have had a risk assessment in an epidemiology course or public health course. Well, Professor Sanieh, he has a very good way to measure risk. He puts sensors on bridges that determine when a crack appears and when that crack might actually cause the structural integrity of the bridge to fail. So he engages in risk assessment. I can't remember the last time I used a sensor on a bridge, but I'm engaged in risk assessment as an epidemiologist and a public health professional. So think about how sustainability might be defined differently depending upon your discipline. Think of, there's a wide area of ability to actually get closer to understanding what you're all doing together by, in these multidisciplinary teams particularly, by establishing definitions and having discussions about them. Struggle over those definitions to a certain extent. That would be my word of advice there. Context is a powerful force in shaping needs and interventions. Certainly, one of the other things I've learned is that in order to make progress on a risk or a topic of interest to us in academia, we have to understand how it is aligned with the needs of the community, right? And does that mean that you only do what's on the top of the list for the community? No, not necessarily. It does mean, however, that if there's an overriding issue that precludes the community even able to be listening to the topic that you're raising, you better well do something about that overriding topic. So one example of this is one year, for a number of years, we worked in the city of Bridgeport on a brownfield site, a site, an urban site that is relatively unpolluted, but had problems in its periphery. And one of those problems was crime. And so we dispatched people to go talk to the residents about chemicals that were loosed in the soil and hotspots of various environmental studies. And no, we don't want to hear about toluene until our cars aren't going to be stolen, or we're not going to be suffering physical violence, or drug trafficking is not going to occur. And so essentially you needed to have discussions and achieve progress in that area before other conversations could happen, right? So there's this hierarchy of sometimes that's important. Now, in terms of this notion of publishing and having peer-reviewed data and not being able to interact with various thought leaders about findings, one of the solutions that we came up with was we said, okay, after some real struggle. And by struggle, I mean some of these meetings, even though you had food and daycare, you could still have disagreements, right? Quite pointed. And that's okay. And some of the things that we decided was, well, what we'll do is, before we publish our papers, we're going to release preliminary data, right, that we're going to share with you and share in a context in which it's going to be much easier. In fact, maybe we should just pass this around. Does that work? So I'm showing the results of the surveys that were conducted and also the results of the implementation of the Verde co-op. One word about the Verde co-op. In public health, and many of you, I think, are concerned about this, one of the growing issues is sustainability of an intervention. You pay for something with a grant for 2 years, you go away, 1 year later, that activity is no longer happening. The behaviors have slipped back to the norms. There isn't this sustainable presence of the information or the intervention that's still existing. So one of the things about the Verde co-op is it's still alive and well. even after 5 or 6 years of not receiving any grant money, at least from Tufts or from the federal government. So it represents an intervention, this cooperative cleaning operation that has achieved economic success because its business model is correct. Source reduction in terms of environmentally friendly cleaning agents. Second, the Brazilian women are vivacious, energetic, extremely good salespeople. Third, some clever use of social marketing. So one of the things that the Brazilian Women's Group has done a really good job on is on social media and Yelp and all that type of stuff in terms of talking about the success. And so here's an intervention which Tufts University is no longer involved in that is still prospering to this day, added more houses that are covered by it and also more members. So it's a success, a successful public health intervention that actually has a business model that is actually working. A final thing I'll say before we get to the question and answer period is that this kind of work is extremely difficult, complex, and exhausting, but ultimately extremely gratifying. And the complexity is given rise by just these names of the various people, as well as the disciplines and agencies that they represent. And this is pretty close to full, but I'm sure I could have even made it bigger. However, you know, the feeling that you have at the end of making something like this work and the lessons that can be learned are really I think really quite compelling. And then the final, there's more information. You have Immigrant Service Providers Group, you have Verde, you have me. Oh, that's way too complicated. I don't want to get to that. And so I think what I'll do is bring this, the formal presentation to an end and take questions. You know, I guess we go until 1. Is that the idea? Okay.
Any questions?
Thank you so much. It's been such an eye-opening, and to know that there's so much great work being done right outside.
Right here.
Yeah.
Yeah.
I was wondering a little bit about the impact of this type of work. Do you have any data, any evidence that this work has improved occupational health of your target population?
So one of the things that has occurred is that there's been some advances made on the legislative front. MassCOSH for Occupational Safety and Health has used some of these experiences as well as some of the experiences they have working with their direct organizations in achieving passing of legislation that is more protective of some of these classes of workers. Also, there has been, particularly in the Verde case, Verde has acted as a model for the creation of other similarly structured co-ops in other cities throughout the United States and actually abroad. So they've, and this, the amazing thing there is, I think they would have done that, you know, with or without, you know, the grant support that we were able to provide them. And that's another thing that should be said about this. Usual way in which money is split in research applications, we had $1 million over 5 years. What was the correct percentage? I think something like 65% of the money went to the community-based organizations. And that is, and there's an internal tough story there. Also, the indirect return was capped at 10% in this grant, which usually, if you get a National Institutes of Health grants, like 52%. So that's money coming into the university that can be then deployed. And one of the things we did, we had a big kickoff for this, and then President Larry Bacow came to that, and he goes, "Oh boy, this looks great. You got $1 million grant." I said, "Yeah, but there's only 10% indirect." He said, sort of made a face. And I said, but this is going to lead to other awards later on down the line. 5 years later, 4 years later, Chris Economos at the nutrition school used the groups that we had been working with, right, to study diet and the phenomenon of it's the so-called healthy immigrant effect. Immigrants will come to this country relatively healthy and then put on weight and acquire some of our other less healthful behaviors. And essentially, she wanted to pilot culturally appropriate nutrition counseling for the various groups. They all leapt into that project. Larry Backout came to that opening, 52% indirect on that one. $2 million grant. And I said, Larry, remember I told you this was, we were going to do something? He said, thank you for reminding me.
David, thank you.
Yeah.
That was just fascinating. I want to come back to sort of two general themes. One is how important it is to work across disciplines. And then the second thing you said at the end is how important it is to be in a discipline. Okay, so I want to think about sort of, you put on your educational hat. We have students in here who are thinking about diving into this.
Yeah.
First of all, how do you learn to work across disciplines? Is there a course that you offer that is interdisciplinary in its nature to sort of expose to the students on how you weave these things together under the premise that they're going to get that disciplinary sort of training so that they can work better in teams in the future? So could you talk about sort of how you would teach this or whether it's such a course?
No, that's a great question, right. And it is extremely important for you to have a discipline in order to be multidisciplinary or intradisciplinary. The course I would point out is a course I developed but now is being taught by Daniel Lantagne, and it's called Public Health Engineering. But don't let the title of it scare off non-engineers, because it's half populated by arts and sciences and half populated by engineers. And the course really is about what skills, what approaches that are sort of firmly within engineering, but then can be used and are accessible to non-engineers as well. So that's one thing. The other thing is I teach it used to be a undergrad and grad level public health course, but now it's entirely undergrad, and there was a similar mix, half engineers, half arts and sciences. And that's a fall course. Danielle's public health engineering is a spring course.
So in that course, I take it you're doing ethnography, doing interviews, but you're also doing data-driven analysis.
And Professor Lantagne also has a course, it's called Global Field Methods, and there you actually develop a research protocol, have to apply for like IRB processes, and it's very much a course about how do you conceptualize work, but the content there is around the sort of the WASH space, so that's hygiene, sanitation. So it wouldn't be as wide a thing as in a wider domain as in engineering, public health engineering, or the public health course.
Any other questions from the audience?
What were the disciplines that were actually very much needed for this project in particular?
Pardon, I didn't hear the first part.
The disciplines that were definitely needed for this project that you did.
What were they? So we had epidemiologists, we had anthropologists, we had occupational and health specialists, sort of merging into sort of the legal area and regulatory level, physician, and statisticians. So biostatisticians, epidemiology, occupational health and safety, and then where do you put the Alex Perrys and Franklin Dallenbergs of the world? And Eloisa, they sort of are able to sort of float among these various aspects of immigrant life, and they have pockets of knowledge that are so deep in certain areas, it almost defies putting a discipline on it. So what we really took advantage of was the real life knowledge base of some of the people that we just depended upon every day to sort of shape our work. And those were the leaders of these community-based organizations and the people that they hired, like the Ismael Vasquez's of the world that you saw a picture of.
Thank you so much. I was going to ask a similar question as Dr. Orions about the importance of multidisciplinary approaches.
Yep.
I unfortunately missed the announcements portion, so I'd love to give a quick shout out for an event happening tomorrow. That's actually a very exciting follow-up. I won't take too much time. Given the interconnectedness of community systems and issues and the importance of multidisciplinary approaches, the Food Rescue Collaborative and the Global Development and Environmental Institute of Tufts, as well as La Société Française, which is the Tufts French Society, have come together to organize a mini symposium about reimagining community systems, and it will start off with a film screening at 2 p.m. of a French film, a documentary called Demain, which means tomorrow. And it's very inspiring about the future of community planning in the face of climate change. And in terms of the multidisciplinary approach, there are 5 chapters of the film, which are agriculture, energy, economy, education, and democracy. And so the filmmakers travel to 10 countries around the world and showcase different, very creative and reinventing communities who are reinventing systems in those fields.
Wow.
So, and we're gonna have a speakers panel, but decided that puts people on a pedestal. Let's just have a group discussion, because as humans, we all have our own expertise in what the future of community solutions could look like.
No, so when's that happening again?
Tomorrow. Join us. I will. Yeah, it should be
Okay,
a great conversation. We have some researchers from Gute, as well as Denise Provost, one of the state representatives for Middlesex County, joining to talk about democracy. But yeah, I hope to see lots of you there. I think you will enjoy it. And even if you can't make it, the film Demain, called Tomorrow, is on Canopy. It's a very inspiring documentary for everyone. So thank you.
Very good. That's a great thing to point out. And it also, you mentioned going around to 10 different countries and acquiring sort of these best practices. One of the other things that I'd like to make sure I say is that one of the things that is extremely true is that some of the strategies that are being used in different cultures and different nations offer great value to those of us in the United States. It's not as if we essentially go and share this great bank of wisdom from the United States and that's it. You know, it's a two-way transfer, right? There's a lot to learn in terms of, you know, achieving progress. Yeah, that's right. That's right.
Well, David, thank you so much again. We'll give you a great big hand.
Thank you. Well, it's my pleasure to be here. And what I did say at the outset is I think I did come to one other, as Colin reminded me, we brought a regional king from Ghana to one of these meetings. But I've always followed your topics. They always seem to be cutting edge and, you know, oh, gee, that's really interesting. And when I first began academic life, I thought, you know, I'm going to go to all these interesting talks. Well, you run out of time pretty quickly. But I think you guys are doing a great job with regards to your topic selection. So you're welcome.
And thank you.
You're welcome. Oh.
If you have any questions, I'm sure.